On Wednesday, 29 October, the VDC of Bakery Sambuya organized a full-day health screening focused on diabetes and hypertension for the community. The initiative was held in partnership with Eden Montessori from the United Kingdom, aiming to promote early detection of diabetes and hypertension among villagers. Speaking to the press, the VDC Secretary Mr. Sambamani expressed that the event marks a significant milestone for the committee. It means a whole lot of progress for this committee because if you look at it globally, diabetes and high blood pressure are conditions that continue to affect the lives of many. So, we felt it was very important to organize an event like this to provide free diabetes and blood pressure checkups for the people of Bakari Sambuya and the surrounding communities, said Mr. Mane.
Of course, it means whole lot of progress for this committee, and because if you look at it globally, diabetes and high blood is something that is definitely hampering the lives of human beings. So, in that regards, we feel like it's very important to come up with an occasion like this. That is to provide free diabetes and high blood pressure checkup for the people of Bakar Samia village and the surrounding. You realize that in our community now we have people, a lot of people who are definitely ignorant of their status, being diabetes or hypertension. And then sometimes people feel reluctant to go to clinics and then have occasional checking like every 6 months or every 1 year. So they don't even go at all. So in that regards, we believe that it's very important to bring it to their doorstep. You know, in terms of going to Birkama, Serakuna, Banjul, or other clinics, that we need to pay a high lot of money or pay fares, make transport arrangement. We feel like, okay, it has to come to their doorstep, and then maybe that will give them the opportunity to come and know their status, because some of these things you definitely need to know your status, so that you can be given the prescribed medication and then maybe control it at some point. But if you are ignorant of your status, you might be doing something that may worsen it, and then at the end of the day, when it dominates your system, then it can lead to other consequences, and which might even lead to death. Of course, for me on my part, I'm not really impressed with the turnout, but then I believe the PRO of the Village Development Committee has done justice to the information, because the information was spread, I believe, 30 days ago. So that should be enough for every member of the community to be aware of this very, very important event in Bakar Sambia. But then the information is still circulating. It's not restricting the ages, because it is from giving opportunity to people of 2 years up to any year, any number, 65, 70, 80, it goes on. So everybody has the opportunity to come up. So we believe some of these middle age are in school at this time. So we'll be with the team here for the whole day, maybe up to 6 o'clock. So maybe when they close from school, we encourage every parent out there, to gather your family to come and do this checkup, which I believe is going to be once at a time. So maybe before you get this opportunity again, it might be another 6 months or 1 year, and then you might not be opportune to check and then know your diabetes status or your blood pressure status. Of course, my concrete advice would be grab the opportunity, get it wherever it is available. Blood pressure and the diabetes is really hampering our society, our living at this stage. So if you have somebody who is providing it for you free, I think you should not waste time. You dare not to waste a minute to go and check your status, because it's always very important. It's always very important. You only know to go to Rome if you know the road that guides you to Rome. So this, I'll encourage every Gambian, young or old, middle aged, children or whatsoever, please, anywhere you hear this information of the provision of free diabetes and blood pressure check, please take the opportunity. Yeah, this is the first time, of course. We are doing this with our partners from UK, that is England. Mary and the team, they are here. We have been discussing about it. It has been in pipeline for some period, but then thank God, it has finally arrived. Today, that is 29th October 2025, for the first time. But then we don't think it is going to be the last time. Yeah, because we thinking of occasionally having this. If you cannot have it in every 6 months, but possibly we will have it every year.
Also speaking to the media, Ms. Selena, a medical practitioner from Eden Montessori, UK, highlighted the importance of such collaborations in improving rural health access.
I think sometimes there's a fear um, between the local people in any country and also medication. And particularly Western medication that they don't necessarily know or they haven't grown up with. So I think where it starts is in getting some of them to come, see what it is, what the process is, and then they can spread the word. Um, so I think even the turnout today is encouraging if one person came. If we were able to just say, find that one person and we found that they were diabetic, like I think today there's been a few people who've been sent straight to the hospital because their condition is so severe. But had we not done this today, they would never have known and it could have been more fatal. So I think for me, it's encouraging, even if we have one person that comes and really needs our help, and the word would then spread and hopefully then others will come from there. So there's been a few, so there's and a few categories. So like I said, there's been about two or three who have needed immediate hospital attention. So they have been sent immediately straight to the hospital. Then there have been quite a few who are on that precipice of diabetes. And so they will require testing the blood test to confirm. There have also then been a huge amount who are at that pre-diabetic stage, which is for us is the really important stage because that's the stage you can turn it around, where it doesn't have to become diabetic. So those will have some medication. They will also then be given some advice as to what they will now do next or what they can do next. And then we've given others who are kind of in that medium range just advice going forwards with the lifestyle, cutting down on maybe some sugar, exercise, that sort of thing. Oh, I think it's high, but I think a lot of that is because of not testing. And I think testing is the important thing because, like I said, with the ones here who we found are at that pre-diabetic stage, had those who were diabetic been tested before at that stage, you wouldn't have that higher number now. So I think there is a high number of diabetes, but that is a lot of it due to not being tested early on. And then if you're tested early on, you can then do something about it. But it's also an issue in the UK as well, where you have a higher number of people who are diabetic or becoming pre-diabetic. So one of the benefits, if you're tested early, you have a chance to reverse your condition. You have a chance to then look and think, okay, maybe I'm not going to have 5 spoons of sugar with my tea. I'm going to have maybe 2 cups of tea instead of 5 cups of tea a day. Maybe I'm going to get up and do some more exercise. Maybe I'm going to eat some more vegetables. Maybe I won't eat so much rice. And it's not like not eating rice all the time, because obviously there is that, if rice is what you have in your house, you can't not eat it. But it's looking at your portion size as well. It's looking at what you have with your rice, the vegetables that you have with your rice as well. So I think the testing is essential to be able to reverse some of the diabetic conditions. It's also essential to be able to manage it for those who are diabetic, because good management is the key. And my colleague who is here, she herself is diabetic, but because she has been managing it so well and she had tested, she's not insulin dependent, she's just on tablets. And she takes great care with what she eats and all of those kind of things. I think the testing is where it starts from. I think if they go to the doctor, they can mention that there was this day here, and they can mention the benefits and say, look, this is something that we have now learned is prevalent amongst Gambians. So I would like to make sure that at the moment I am not diabetic, or if I am diabetic, I would like to know so that I can make a change. But they can also just come to the clinic We'll be leaving some of the things here at the clinic. They can come to the clinic. If not today, whenever they feel they can come down and be tested here as well.
One of the beneficiaries of the diabetes and hypertension free checkup expressed gratitude to the organizers, saying,
ñun kontaan nañ trop ci faju bi ñëw nii parce que dañ dee jógee fii léeg-léeg ba Banjul léeg-léeg wala ba leen hôpital wala kaani fi fale pour war a uti faju bu mel nii léegi comme ñun am ñëw nañ fii nii rek ñu am ko ci suñu tànkanoon suñu bunti kër loolu kontaan nañ ci loolu bu baax a baax a baax loo xam ne xamuloo ko woon ci sa yaram boo ñëwee fii rek danga koy xam muy sa deret bi moo eeg muy sa deret moo wàcca danga koy xam muy sa sukur bi moo eeg wala moo wàcca danga koy xam donc faju bu nekk di am fii nii baax na torop ci ñun.
The program concluded with a message of commitment from both partners to continue similar initiatives in the future to promote community health and well-being.